Welcome to today's episode of Innovation in Medical Tourism, where we will deep dive into matters that are the most important for medical tourism. I'm your host, Diana Cueva Soriano, President of the World Council for Medical Tourism. And today we have an exciting guest who has made significant strides in healthcare. Our guest has not only inspired many, but also brought many changes in the digital and artificial intelligence area of healthcare. Join us to explore the journey, challenges, and insights of this exclusive interview. Today we have Dr. Joseph Bassem, which is an orthopedic surgeon from the American University of Beirut and healthcare consultant, boasting a quarter-century of experience in both clinical practice and healthcare administration. He holds a prestigious fellowship in the American College of Surgeons and earned a combined master's in hospital and healthcare management from ISA, Lebanon, and Paris Diderot, with a specialty in healthcare information technology, currently serving as Chief Operating Officer at the University of Balamand. Mr. Bassem also holds a position of Assistant to the President of Health Affairs and Administration, Director of Medical Simulation Center at the University of Belmont. Additionally, he serves as an executive board member and chair of the Digital Health and Artificial Intelligence Department of the Arab Hospitals Federation. His exclusive background includes advising the Minister of Health, consulting for the World Bank Health Sector Rehabilitation Program, and directing programs at the World Health Organization. Dr. Bassem is a recognized expert in applying artificial intelligence technologies within healthcare settings, focusing on enhancing healthcare delivery, improving diagnostic accuracy, optimizing patient outcomes, and advancing healthcare operations. He has spearheaded numerous artificial intelligence-driven projects, implementing innovation solutions such as predictive analytics, telemedicine platforms, digital imaging diagnostics, and artificial intelligence-powered decision support systems. His pioneer work continues to shape digital transformation strategies and healthcare innovation across the Arab region. Dr. Bassem, thank you very much for being here. It's an honor to have you.
Thank you very much, Diana, for inviting me to this interesting podcast. And I feel good that I am podcasting with you from Mexico to Lebanon. It's a long distance, 7 hours difference, but I'm happy that I'm sharing my thoughts with you as the president of the Medical Tourism Society. So I'm ready to answer any question you feel like to ask about this emerging topic, which is good but scary at the same time.
It is indeed. As you know, in the World Council for Medical Tourism, we focus in global governance or the lack thereof, and trying to make the medical tourism industry a much better place and a safer place for everybody. So my first question for you would be, the medical tourism industry has been transformed in many ways, and we have found ways to mitigate risks and make it safer than it was before. I would like to know, from your perspective, what exactly is smart medical tourism, and how does technology enhance the patient's experience?
You know, smart medical tourism is the trend now because we are always talking about smart technology. So it is the evolution of traditional medical travel, which it is enhanced through the integration of digital technologies like artificial intelligence, telemedicine, wearable device, and electronic health record. So this is the whole package that makes from it it's smart. And it transforms the patient journey into a seamless, personalized, and data-driven experience. You know, from the moment of a patient who considers traveling for care to post-treatment recovery. So it's a long journey. It's not only now when you talk about smart tourism, it's not only his presence in another country. He can be at home and using this smart medical tourism. So this is through this virtual consultation and AI-powered platforms, patients, they can receive expert guidance, they can have tailored treatment options, and pre-travel medical assessment, this is very important, without leaving their homes. And this technology, it enables remote monitoring via wearable devices and centralized health data sharing, ensuring that we have safe protocols and better coordination between international providers.
That's correct. Protocols are very important to have them as a coherent method for a global perspective and strategy to make it more harmonious, globally speaking. That's right. How is artificial intelligence?
And in addition to this as well.
Go ahead.
Sorry. Yeah. No, I was just telling you that we have, in addition to this, we have as well the mobile apps, the blockchain that will secure health records. Maybe later on we'll go into the details of each in the questions. But there are a lot of things that we can use it that will help us in this smart medical journey.
That's correct. That's correct.
Okay.
So how is artificial intelligence shaping the future of medical tourism?
Let's start. AI, it is significantly shaping the future of medical tourism by making healthcare more personalized. We are talking now about precision medicine and personalized medicine. This is the trend, and it's going to be the future in medicine. And we are talking about accessible and efficient services across borders. It's going to be more attractive. I can tell you, with medical tourism, the advantage of the technology and AI is more important than its advantage on premises, because the technology is changing the whole mindset in medical tourism. So through these data-driven insights, AI can match patients with the most suitable destinations. So AI will help us where to go, and location at hospitals and the specialists based on our medical history, preferences, and budget. It's a continuous system that the AI system, it will read all our information, financial, whatever, and they will give us the most suitable place to go. And it powers intelligent chatbots, very important, the chatbot in the medical tourism, the smart medical tourism, the chatbot, because we can have a virtual assistant as well, and automated platforms. They streamline booking, translation, consultation, and even post-treatment follow-up. So it's all through this process. And it creates a smoother, faster, and a more customized patient journey, enhancing satisfaction and trust in global care providers. It's very important, this, because we know the problems they face people when they go from a country to another country seeking care. When they are going, it's not regular tourism, so they have problems. AI and technology is helping them cross all these barriers. Moreover, we can have also AI, it supports clinical decision making by analyzing the data sets, enabling more accurate diagnosis and tailored treatment plan, especially in areas like oncology, fertility, and orthopedic surgery, where the key drivers are for the medical tourism. This is more important problems where people seek for medical tourism. And there's something as well, which is very important. AI, it plays a role in fraud detection, because the verification of the medical report, everything, it's controlled properly through AI. And we have secure data exchange, and we have real-time monitoring. This is very important, and this is going to be the future. The wearables that we are using, now we are using it as like a luxury. Within 5 years from now, all these wearables will be used for real-time monitoring of our conditions. So wherever you are traveling in plane, in airports, anything, you are being monitored every time. And this will improve patient safety during the travel and during the recovery. And
that's very
AI
interesting
as well, it continues to evolve. we are, every day we have a lot of things new in AI, and this it will help healthcare providers to offer smarter, value-based service and making international healthcare not only more innovative, but also they are more inclusive and results driven.
Awesome. So besides AI, what would you consider then to be the main technological tool currently transforming medical tourism globally?
In AI, there are a lot of technological trends which are currently transforming the whole global medical tourism landscape and enhancing patient care. We have telemedicine. Now, telemedicine is becoming a cornerstone in medical tourism, enabling patients to consult with international specialists remotely, and it facilitates treatment decision and most importantly, post-operative follow-up without the need for travel, because they can be at home to be monitored. AI, as well, it is revolutionizing the diagnostics and treatment plan by analyzing this data set to provide the personalized medical recommendation. Now, one of the technologies that we are talking about is robotic surgery. It offers increased option abroad. Now you can stay at home if you have the robot at your place and you seek medical tourism from a surgeon who is in another country. So you are staying at your home, at your place. You go to a local nearby hospital where there is a robot. You are seeking the expertise of the surgeon. So the surgeon, instead of you going to his place, he will come virtually and he will operate on you through the robotic surgery. It's all changing with this smart technology. And as well, we have the wearable health device and the remote monitoring tools, because they allow continuous tracking of vital signs, ensuring patient safety and effective post-treatment care, regardless of any geographic location.
So can we say that? Go ahead.
There is as well the virtual and the augmented reality technology, VR and augmented reality, because they enhance patient experience by providing virtual tour of the medical facilities and simulating the procedure. Thereby, you reduce the anxiety and improve the preparedness. It's very important before you go to a place, you can use this VR so you know exactly where you are going, so less stress. And there is as well the blockchain technology that it will ensure safe and secure handling of medical record.
Which means that will this also improve affordability for healthcare services?
Exactly. It will improve because it's facilitating all the things that we were facing before. We were having a lot of problems without this technology. There were a lot of barriers that would prevent us from a proper medical tourism. So it improves both accessibility and affordability by reducing the barriers, as I said, related to geography, time, and cost. Because it's less costly, the time is more efficiency, and the location, geography. As I tell you, you can do medical tourism without leaving your country. So through the telemedicine, patients, they can access specialist consultation from anywhere in the world. It will minimize the need for multiple trips. Sometimes in medical tourism, they spend a lot of things, consultation, preparation. This phase is not needed anymore physically. It can be done virtually until the final decision for, let's say, for a surgery. So we have this AI platform, okay? They help patients compare prices as well, treatment options, and reviews across international hospitals. They can do this benchmarking to know where to go as well. So it's all now digital, and it's available to everyone. And the mobile apps, the online booking system, and the virtual health assistant, it streamline logistics, and it reduces administrative overhead and enhancing the convenience. Life is easier with technology.
Sure. So speaking about telemedicine, obviously this plays it's a very important role and tool for international patients. And my question for you would be, what would be the biggest challenge in telemedicine, taking in consideration the different jurisdictions and laws regulating telemedicine in the sense of to what extent can telemedicine be considered a medical consultation?
Okay. First, let me tell you, telemedicine, it plays a pivotal role in attracting international patients by removing the traditional barriers to cross-barrier healthcare. It also it allows potential medical tourism to connect with doctors and specialists abroad for pre-treatment consultations. This builds trust and confidence that before committing to travel, a patient can access the provider experience.
Right.
So treatment approach and service quality will be present in advance. Okay. Telemedicine, it offers as well post follow-up, post treatment or post operative follow-up after they return home, and it will help in monitoring the recovery, adjusting medication, and to respond to complication without requiring a patient to fly back. Okay, so there is a convenience and safety in this. As for the challenges, that challenges in telemedicine, it is like not only for smart medical tourism, for everything. We are still having now the trust. People, should they trust talking over the phone, over the screen with the physician? Who is accountable if there is any mistake? This is the same challenge that we are facing with telemedicine, even if we are practicing in the same country. There are a lot of people, I tell you, in our area, there are people that don't trust being treated through screen, even if they are seeing a real physician. I can tell you in the future, we might have avatar doctor, no more a real doctor. So this is it will come very, very soon. And this is scary, but still, these are the challenges, and the culture of AI, culture of technology, it differs from a country to country. But at the end, if we don't go in parallel with the technology, we can lose the market and we cannot move forward, even cannot practice medicine properly. So this is why our role is not only to provide the technology. Our role is to convince people of its advantage and to make sure about the regulation and legislation that you are not doing anything that will affect their information, the medical information, and decision making. We have to make sure that somebody should be accountable. So these are the
That's correct.
challenges. Yeah.
That would be key. Accountability and responsibility to whomever is consulting or behind the scenes. That would be, from our perspective, one of the most important elements of telemedicine. So how would we be able to ensure data privacy and patient confidentiality?
To ensure this data privacy and confidentiality in this era of digitalization, we must adopt a robust security framework, and we should comply with the national and international regulation. Let's say in the States, we have to be HIPAA compliant. So all the systems that you are using in healthcare, the softwares, the hardware, they should be HIPAA compliant. And in Europe, we have the GDPR in Europe. Okay, so we have to have all the systems compliant with the international regulation. This will help a lot to secure information. So we need as well to implement end-to-end encryption for all the digital communication, and we have to have secure cloud storage. There are people that believe in storage on premises. For me and for a lot of experts, saving our information on cloud is safer if it is a secure cloud storage solution, because the risk of breaching and accessing information on premises is higher. There are multi-factor authentication as well needed to control access to sensitive data. This is part to make sure that we have secure patient confidentiality. And I can tell you as well that we have to have in our places like cybersecurity audits, train staff on data protection protocols, and use technologies, blockchain. Now, blockchain is the trend. So, and it is very important if you do it because it allows verification of data with high level of security. So we have to prioritize ethical data governance, secure infrastructure, and to have a continuous monitoring of healthcare institutions that can protect patient trust while embracing this digital innovation.
That's correct. You just nailed it because for us it's highly important patient safety, confidentiality, privacy, but as well as protection to both sides, protection
Yes,
for the patient and protection for the providers. And
exactly.
this is one of the main elements of the World Council for Medical Tourism is, as you just said it, governance and compliance. As long as everybody is in compliance, it would be much easier globally to have a governance that suits all and can regulate universally, so to speak.
Exactly.
So how do smart medical tourism strategies help in crisis management, such as pandemics and geopolitical, geographical instabilities?
You know, we all during COVID-19 era, we learned a lot because I guess what happened in the world in COVID-19 made us think out of the box to find more solutions because it was a worldwide pandemic. So we have now a lot of systems that are being implemented, and the strategies that the smart medical tourism should play, it's in crisis management. We should enhance systems of resilience, adaptability, and continuity of care during disruption. So these systems, we can do it through telemedicine and remote diagnostics because patients, they can continue having access of care without interruption, without need to travel, and reducing the risk of and maintaining treatment schedule even when borders are closed and the mobility is restricted. So this is very important. And in COVID-19, we all resorted to telemedicine, even in our homes. A nearby doctor, he is maybe a block away from you. We were
Yeah,
talking
that's
over the phone
correct.
because we cannot. So
Yeah.
telemetry was one of the solution. With smart medical tourism, it's very important about this. There's as well we need this AI-powered analytics also to enable real-time monitoring of global health trends. It's very important to predict what's going on, to look for the high-risk areas, the hot zones, let's say, for any infection outbreak like COVID or any other areas. So this will have providers anticipate outbreaks and adjust service offering accordingly. There's as well, there are digital platforms that can swiftly reroute patients to safer destination. In terms when you have a problem, automatically you are rerouted to another destination which is safe. They manage cancellation and they communicate critical updates and maintain trust. And of course, because this is what's seen clearly in COVID-19, minimize confusion. We had a lot of confusion during that era. And when we have this cloud-based medical records, it ensures that the data is available wherever you travel. So it will be accessible from anywhere, while as well we need to have this automated logistics, the big systems. They help manage shifting travel regulations or healthcare capacity. So we are, with this technology, we ensure flexibility and patient safety, which makes medical tourism more sustainable and dependable even in times of global uncertainty.
Yes, without a doubt, technology is totally reshaping not only medical healthcare, but medical tourism. So what would
Yes.
you recommend providers, healthcare providers or destinations that want to adopt or expand their smart medical tourism capabilities?
You know, to successfully adopt or expand smart medical tourism capabilities, I guess healthcare providers and destinations, they should focus on strategic investment, and they should work on patient-centered innovation and cross-border collaboration. This is very important because the most tourism is cross borders from the most common. It's cross border between countries, and we should invest first in digital infrastructure. Include we have secure EHR systems, AI-driven platforms, and telemedicine tools. These are the important to streamline operations and improve the patient journey. And we should ensure that all digital solutions that are interoperable. If we don't have interoperable digital solution, it's no use. And they should be compliant, as we said, HIPAA, GDPR for data privacy and security. There is as well this executive in the healthcare, they should adopt an experience-driven approach by offering multilingual support, the language translation between people coming from different countries. They should have virtual consultation, the digital care navigation, and post-treatment follow-up. This is very important. And training staff in digital literacy and cultural competence, it's key to maintaining quality and trust. And sometimes the medical tourism program, they fail from one country to the other because of difference of language, because of difference of culture. So they should be trained on how to welcome people coming from other areas. And I'm sure the technology and all the platforms that we are having now, it helps a lot in training staff. And finally, we should build like an international partnership with insurers, governments, and travel agencies to enhance like a kind of global visibility in order to integrate travel health services and develop a responsive system for crisis management. It's very important. And by combining all this technology with empathy, it's very important. Empathy, we cannot, although we're talking about technology, we are talking about AI, but by combining all this with empathy, I guess healthcare providers can position themselves as leaders in the future of smart, resilient, and patient-centric medical tourism.
Absolutely. I think that is very important. And what you said last, it's extremely insightful because, in fact, the World Council for Medical Tourism is exactly the platform that is combining the ecosystem and every player that is within medical tourism to create a world alliance where everybody is in coherence, where we can take care of, as you said, different platforms, different cultures, different jurisdictions as a whole. So it's harmonious and coherent around the world with the same set of protocols and standards. So everybody has the same capabilities and the same information and the same, as I said, standards for quality, standards for patient care, standards, legal standards. So that's exactly what the World Council does, besides what you said as well regarding the training. We're going to have a seminar on medical liability for medical tourism. It's very important what you said, that everybody needs to be trained in a global scenario.
Yes.
Under the umbrella of international law or the lack thereof, creating a harmonious, again, governance. We've been attorneys, we've been doing this for 30 years. So we have the most robust training program exactly for that, taking in consideration the American Medical Association protocols, the HIPAA
Yes.
regulations, European regulations and directives, global governance, international law, and international healthcare policies so we can adapt and adhere all of them to make them a platform that is for everybody and taking in account best practices and protocols for all of us to be in the same page. This was very insightful and extremely interesting, Dr. Bassam, especially for those who want to understand the new trends and digital tools, available for medical travelers, providers, and the global healthcare industry in general. Thank you very much, Dr. Bassam. I invite you and all our listeners to our seminar for medical liability for medical tourism, which is going to be held in Amman, Jordan on May 8th and 9th, 2025. This would be a time for sharing insights and all the thoughts, especially the great knowledge that Dr. Bassam brings in this interview. Again, we thank you for your time and sharing your vast knowledge clearly. And we invite all our listeners to subscribe to our channel. Remember, the World Council for Medical Tourism is your source for best practices, trust, and global governance. I hope to have the opportunity to interview you again, Dr. Bassam. We run out of time, but clearly you have a lot to say and we all have a lot to learn from you.
I would like, Diane, to thank you for this important session. I'm very happy because it's a worldwide exposure to talk about this topic. And I'm sure we can have more work with you in our territory, in the Arab region, with the Arab Hospital Federation. Maybe we do a specific event on smart medical tourism, inviting all key holders and the executive in the area for such an event. And thank you again.
Absolutely. Absolutely. We'll work on that. Well, we thank everybody and we'll see you in our next episode. Take care and subscribe.